Unit 21. Health and Diseases. Learning objectives. At the end of this lesson, the students will be able to understand the types of abuses and associated behavioral changes. Gain knowledge of prevention and protection from child sexual abuse. Know the causes for drug, tobacco, and alcohol addiction and its effects on health. Analyze the possible ways of de-addiction. Know about the diseases and disorders associated with lifestyle modification. Compare the features of type 1 and type 2 diabetes mellitus and relates the signs and symptoms. Explain the underlying cause and symptoms for obesity, heart disease, cancer, and AIDS. Suggest remedial measures for prevention and control of these diseases and disorders. To create awareness among the individuals in the society to lead healthy life. Introduction. Abuses occur in a variety of forms and are deeply rooted in cultural, social, and economic practices. Solving this global problem, however, requires a much better understanding of its occurrence, causes, and consequences with context to sexual and childhood abuse. This is followed by substance abuse. Are people leading healthier lives in today's modern world than their generations did in the past? For instance, smoking cigarettes, alcohol addiction, use of drugs, eating high fat and cholesterol rich diets, excessive intake of junk foods, reduced physical activity are some of the risk factors for illness and early death. The role of behavior in health has been receiving increased attention in countries around the world. The health habits of the individuals and their behavior influence the development of chronic and fatal diseases such as diabetes, obesity, heart disease, cancer, and AIDS. These conditions can be substantially reduced by adopting lifestyles that promote wellness and protect their health by taking nutritious diet, regular exercise, and by avoiding drugs, alcohol, and smoking. Abuse and types of abuse. Abuse refers to cruel, violent, harmful, or injurious treatment of another human being. It includes physical, emotional or psychological, verbal, child and sexual abuses. Abuse can occur within the family and with people who are not associated with the family. These days, the use of drugs, alcohol, and tobacco has been increasing, especially among teenagers and adolescents, for adventure, excitement, curiosity, and experimentation. Let's analyze some of the consequences of sexual and childhood abuse, its prevention and protection. Child abuse. Child abuse constitutes all forms of physical or emotional ill treatment, sexual abuse, exploitation resulting in child's ill health, survival, and development. Physical abuse of a child is defined as those acts that cause physical harm, such as threatening, beating, kicking, and hitting the child. Sexual abuse. Sexual harassment is a form of power and dominance of one's person over another, which can result in harmful consequences to the victim. It refers to inappropriate or forced sexual contact. Adolescent girls and women encounter sexual harassment in different forms. Sexual abuse is more common at workplaces. Verbal remarks, comments, gestures, and looks are the most common forms of abuse. This results in psychological distress, physical illness, and eating disorders in the affected individuals. Child sexual abuse. Children are considered soft targets for sexual abuse because they may not realize that they are being abused. Commonly, abusers or persons well known to the child may even be living in the same locality. Abusers also bribe, that is, use chocolates and toys to lure children and take advantage of the child's innocence. Sexually abused children show symptoms of genital injury, abdominal pain, frequent urinary infection, and behavioral problems. More to know. The Ministry of Women and Child Development championed the introduction of the Protection of Children from Sexual Offences (POCSO) Act in 2012. People who traffic children for sexual purposes are also punishable under the provisions relating to the Act. Objectives of the POCSO Act 2012: to protect children from the offences of sexual assault, sexual harassment, pornography, to establish special courts for speedy trial of such offences. Approaches for protection of an abused child. Measures adopted for monitoring and assessment of an abused child who have undergone signs and symptoms of distress are Child Helpline. The Child Helpline provides a social worker who can assist the child by providing food, shelter, and protection. Counseling the child. Psychologists and social workers should provide guidance, counseling, and continuous support to victimized child. Family support. The victimized child should be supported by the family members. They should be provided with proper care and attention to overcome their sufferings. Medical care. A child victim of sexual offences should receive medical care and treatment from healthcare professionals to overcome mental stress and depression. Legal counsel. The family or the guardian of the child victim shall be entitled to free assistance of a legal counsel for such offence. Rehabilitation. Enrolling in schools and resuming their education is an important step towards rehabilitation of the child. It is essential that the child's life is gradually returned to normal after the incidence of abuse. Community-based efforts. Conducting awareness campaign on child abuse and its prevention. More to know. The National Commission for Protection of Child Rights, that is NCPCR, was set up in March 2007 under the Commissions for Protection of Child's Rights, CPCR Act 2005. This Act emphasized the principles of universality and inviolability of child rights and recognizes the tone of urgency in all the child-related policies of the country. Protection of all children of all age group up to 18 years of age is of equal importance. Policies define priority actions for the most vulnerable children. Prevention of child sexual abuse. The most important social policy proclaimed universally is the prevention of child abuse. Taking steps to prevent childhood sexual abuse is parental and institutional responsibility. Instructions to be given by parents and teachers to the child are: do not talk to any suspected person or strangers and to maintain a distance. Not to be alone with unknown person. To be careful while traveling alone in public or private transport. Not to receive money, toys, gifts or chocolates from known or unknown person to them without the knowledge of their parents. Not to allow known or unknown person to touch them. It is the responsibility of every individual living in a society to ensure a safe and protected environment for our children, to enable them to live with dignity and free from any form of violence. Drug, alcohol, and tobacco abuse. The physical and mental dependency on alcohol, smoking, and drugs is called addiction. The addictive potential of these substances pulls an individual into a vicious cycle leading to regular abuse and dependency. This is of serious concern because abuse of tobacco, alcohol, or drugs produce many harmful effects in an individual, to the family, and even to the society. This dangerous behavior pattern among youth can be prevented through proper guidance. Drug abuse. Drugs are normally used for the treatment of disease on advice of a physician and withdrawn after recovery. A person who is habituated to a drug due to his prolonged use is called drug addict. This is called drug addiction or drug abuse. A drug that modifies the physical, biological, psychological, or social behavior of a person by stimulating, depressing, or disturbing the functions of the body and the mind is called addictive drug. These drugs interact with the central nervous system and affect the individual physically and mentally. Types of drugs. There are certain drugs called psychotropic drugs which acts on the brain and alter the behavior, consciousness, power of thinking and perception. They are referred as mood altering drugs. Drug dependence. Persons who consume these drugs become fully dependent on them. They cannot live without drugs. This condition is referred as drug dependence. Physical and mental dependence. Dependence on the drug for normal condition of well-being and to maintain physiological state. Psychological dependence is a field that drugs help them to reduce stress. Do you know International Day Against Drug Abuse and Illicit Trafficking is June 26th. Narcotic Drugs and Psychotropic Substances Act was introduced in 1985. Behavioral changes of drug users. Adverse effects of drug use among adolescents are drop in academic performance, absence from school or college, lack of interest in personal hygiene, isolation, depression, fatigue and aggressive behavior, deteriorating relationship with family and friends, change in food and sleeping habits, fluctuation in body weight and appetite, always looking out for an easy way to get money for obtaining drugs, prone to infections like AIDS and hepatitis B. Do you know? World Health Organization in 1984 suggested the use of the term drug dependence in place of drug addiction or drug abuse. Drug de-addiction. Management of de-addiction is a complicated and difficult task. The path to recovery of drug addicts is long and often slow. Family members, friends, and society on the whole have a very important role to play. Detoxification. The first phase of treatment is detoxification. The drug is stopped gradually and the addict is helped to overcome the withdrawal symptoms. The addict undergoes severe physical and emotional disturbance. This is taken care by specific medication. Psychotherapy. Individual and group counseling is given by psychologists and counselors. The treatment includes efforts to reduce the addict's stress, taught new ways to solve everyday problems, adequate diet, rest and relaxation. Counseling to family members. Social workers counsel family members in order to change the attitude of rejection so that the addict is accepted by the family and the society. Rehabilitation. They are given proper vocational training so that they can lead a healthy life and become useful members of the society. Tobacco abuse. Tobacco is obtained from the tobacco plant Nicotiana tabacum and Nicotiana rustica. The dried and cured leaves of its young branches make the commercial tobacco used worldwide. Addiction to tobacco is due to nicotine, an alkaloid present in it. Nicotine is a stimulant, highly harmful and poisonous substance. Tobacco use. Tobacco is used for smoking, chewing, and snuffing. Inhaling tobacco smoke from cigars, cigarettes, bidis, pipes, hookah is called smoking. Tobacco in powder form is chewed with pan. When powdered tobacco is taken through nose, it is called snuffing. Smoking hazards and effects of tobacco. When smoke is inhaled, the chemicals get absorbed by the tissues and cause the following harmful effects. Benzopyrene and polycyclic hydrocarbons present in tobacco smoke is carcinogenic, causing lung cancer. Causes inflammation of throat and bronchi, leading to conditions like bronchitis and pulmonary tuberculosis. Inflammation of lung alveoli, decreased surface area for gas exchange and cause emphysema. Carbon monoxide of tobacco smoke binds to hemoglobin of RBC and decreases its oxygen carrying capacity, causing hypoxia in body tissues. Increased blood pressure caused by smoking leads to increased risk of heart disease. Causes increased gastric secretion, which leads to gastric and duodenal ulcers. Tobacco chewing causes oral cancer. Infobits. World Health Organization in 1984 suggested the use of the term drug. WHO issued a directive under which all cigarette advertisements and packs carry a statutory warning: smoking is injurious to health. Prevention of smoking. Knowing the dangers of smoking and chewing tobacco, adolescents and the old people need to avoid these habits. Proper counseling and medical assistance can help an addict to give up the habit of smoking. More to know. Anti-Tobacco Act was passed on May 1st, 2004. By 2030, tobacco is expected to be a single biggest cause of death worldwide, accounting for 10 million deaths per year. May 31st is observed as No Tobacco Day, World Anti-Tobacco Day. Alcohol abuse. The consumption of alcohol is a social evil practiced by the wealthier and poorer sections of the society. The dependence of alcohol is called alcoholism, and the addict is termed as alcoholic. It is called alcohol abuse. Drinking of alcohol impairs one's physical, physiological, and psychological functions. Harmful effects of alcohol to health. Prolonged use of alcohol depresses the nervous system by acting as a sedative and analgesic substance. Some of the harmful effects are nerve cell damage resulting in various mental and physical disturbances, lack of coordination of body organs, blurred or reduced vision results in road accidents. Dilation of blood vessels, which may affect functioning of the heart. Liver damage resulting in fatty liver, which leads to cirrhosis and formation of fibrous tissues. body loses its control and consciousness, eventually leading to health complications and ultimately to death. Rehabilitation measures for alcoholics. Education and counseling. Education and proper counseling will help the alcoholics to overcome their problems and stress, to accept failures in their life. Physical activity. Individuals undergoing rehabilitation should be channelized into healthy activities like reading, music, sports, yoga, and meditation. Seeking help from parents and peer groups. When a problematic situation occurs, the affected individual should seek help and guidance from parents and peers. This would help them share their feeling of anxiety, wrongdoing, and get rid of the habit. Medical assistance. Individuals should seek help from psychologists and psychiatrists to get relieved from the condition and to lead a relaxed and peaceful life. Alcohol de-addiction and rehabilitation programs are helpful to the individual so that they could get rid of the problems completely and can lead a normal and healthy life. Diseases and disorders due to lifestyle modifications. Diseases are prevalent in our society due to our improper way of living, conditions of stress and strain. These diseases are non-communicable and affect the person who are suffering from particular symptoms. It is an impairment of the body tissue or organ, disturbances in metabolic functions which require modification of an individual's normal life. Diabetes mellitus. Diabetes mellitus is a chronic metabolic disorder characterized by the body's inability to produce or effectively use insulin, a hormone essential for regulating blood sugar levels. The term diabetes is derived from the Greek word diabetes, meaning to pass through, and mellitus comes from the Latin word mellitus, meaning honey sweet, a reference to the excessive sugar found in the urine of individuals with this condition. Diabetes is a condition in which your blood sugar level is too high. Carbohydrates are the substances your body uses to make energy. After you eat food that contains carbohydrates, it eventually goes to your small intestine. In your small intestine, the food is broken down into single sugar molecules called glucose. The cells in your small intestine soak up the sugars which pass into your bloodstream. When the blood reaches your pancreas, it detects the high amount of sugar in your blood. Normally, this causes your pancreas to put a chemical called insulin into your bloodstream. The insulin reduces the amount of sugar in your blood to a healthy level. How does insulin do this? As the blood moves through your body, the insulin and sugar exit the bloodstream into your tissues to reach your cells. Most cells have structures on their surfaces called insulin receptors. When insulin flows by, it attaches to the receptors. The insulin acts like a key in a lock to open up the cell, so the sugar can get inside. Now your cell can use the sugar to make the energy it needs to work properly, and your blood sugar level drops back to its normal range. If you have type 2 diabetes, your cells don't respond to insulin as they should. This is called insulin resistance. When this happens, your insulin cannot unlock the cells to let sugar in because the locks or insulin receptors are missing or aren't working. As a result, sugar is locked out of your cells. When sugar can't get into your cells, it builds up in your bloodstream. This is a condition called hyperglycemia. In response to the high blood sugar levels, your pancreas makes more and more insulin. The overworked cells in your pancreas try to keep up, but they slowly lose their ability to make enough insulin. These problems may lead to the symptoms of type 2 diabetes. Type 1 Insulin Dependent Diabetes Mellitus, IDDM. IDDM accounts for 10 to 20% of the known diabetes. The condition also occurs in children, that is juvenile onset diabetes, and young adults. The onset is usually sudden and can be life-threatening. This is caused by the destruction of beta cells of the pancreas. It is characterized by abnormally elevated blood glucose levels, that is hyperglycemia, resulting from inadequate insulin secretion. Causes: genetic inheritance and environmental factors, that is infections due to virus, acute stress are the cause for this condition. Type 2 Non-Insulin Dependent Diabetes Mellitus, NIDDM. This is also called as adult onset diabetes and accounting for 80 to 90% of the diabetic population. It develops slowly, usually milder and more stable. What causes type 2 diabetes? In type 2 diabetes, the body either does not make enough insulin or is not able to use it properly. Type 2 diabetes usually begins with insulin resistance. This is when the cells can't use insulin properly. As we explained earlier, insulin is a hormone made in the pancreas, a gland near the small intestine. Special cells in the pancreas called beta cells make the insulin. The body constantly checks how much sugar is in the bloodstream When blood sugar levels rise beyond a certain point, the body signals the pancreas to release insulin. Insulin helps the cells use sugar. The diagnosis of diabetes is given when not enough insulin is available, either because the pancreas can no longer keep up with the demand or because the body can't use the insulin that is produced. Let's take a closer look. Cell walls have little locks called receptors. Insulin fits into those locks like a key. When insulin opens the locks, sugar is allowed to enter the cells. When the body is not able to make enough insulin, blood sugar is locked out of the cells. Sometimes the locks change in shape. Then the insulin can no longer fit into them. Either way, blood sugar is locked out of the cell. It stays in the bloodstream and can become too high, causing hyperglycemia, which can lead to the symptoms of diabetes. When cells cannot get sugar, they no longer have the fuel they need. The pancreas tries to make up for this by working harder. At first, the pancreas keeps up by making more insulin. In time, the pancreas is unable to continue doing this, which is when the symptoms of diabetes may appear. Causes. The causes are multifactorial, which include increasing age, affecting middle-aged and older people. Obesity, sedentary lifestyle, overeating, and physically inactive. More to know. 1 in every 8 individuals in India is a diabetic. The revised WHO estimates for the year 2025 is 57.2 million diabetics in India. The average age for the onset diabetes is 40 years, while it is 55 years in other countries. World Health Organization projects that diabetes will be the 7th leading cause of death by the year 2030. Symptoms. Diabetes mellitus is associated with several metabolic alterations. The most important symptoms are increased blood glucose level, that is hyperglycemia, increased urine output, that is polyuria, leading to dehydration. Loss of water leads to thirst, polydipsia, resulting in increased fluid intake. Excessive glucose excreted in urine, glycosuria. Excess hunger, polyphagia, due to loss of glucose in urine. Fatigue and loss of weight. According to WHO recommendation, if the fasting blood glucose is greater than 140 mg per deciliter or the random blood glucose is greater than 200 mg per deciliter on more than 2 occasions, diagnosis for confirming diabetes is essential. Prevention and control of diabetes. Diet, hypoglycemic drugs, insulin injection, and exercise are the management options based on the type and severity of the condition. The overall goal of diabetes management is to maintain normal blood glucose level. Dietary management. Low carbohydrate and fiber-rich diets are more appropriate. Carbohydrates should be taken in the form of starch and complex sugars. Refined sugars, that is sucrose and glucose, should be avoided. Diet comprising whole grains, millets, that is jowar, bajra and ragi, green leafy vegetables, wheat and unpolished rice should be included in diet regularly. Carbohydrates is maintained to about 50 to 55% of the total calories. High protein content of 10 to 15% of the total intake is required to supply essential amino acids. Fat content in the diet should be 15 to 25% of the total calories. Saturated fat intake should be reduced. Polyunsaturated fatty acid content should be higher. Management with insulin. Commercially available insulin preparations, short and long acting, are also used to maintain blood glucose levels. Physical activity. Exercise plays an important role in facilitating a good control of diabetes, in addition to strengthening and toning up the muscles. Education and awareness. People with diabetes should be educated on the nature of disease they have and the possibility of complications of the disease if blood sugar is not kept under control. Instructions regarding diet, exercise and drugs should be explained. Infobits. Flax seeds containing insoluble fiber, guavas, tomatoes and spinach are foods which help reduce blood sugar levels. Obesity. Obesity is the state in which there is an accumulation of excess body fat with an abnormal increase in body weight. Obesity is a complex multifactorial chronic disease developing from influence of social, behavioral, psychological, metabolic and cellular factors. Obesity occurs if intake of calories is more than the expenditure of energy. Overweight and obesity are conditions where the body weight is greater than the mean standard weight for age and height of an individual. Body mass index (BMI) is an estimate of body fat and health risk. More to know. Every 7 calories of excess consumption leads to 1 gram fat deposit and increase in body weight. Weight due to fat in adipose tissue exceeds more than 20% to 25% of body weight. An adult weighing 10% more than the standard weight is overweight and 20% more is obese. Causes and risk factors. Obesity is due to genetic factors, physical inactivity, eating habits, that is overeating, and endocrine factors. Obesity is a positive risk factor in development of hypertension, diabetes, gallbladder disease, coronary heart disease, and arthritis. Prevention and control of obesity. Diet management: low calorie, normal protein, vitamins and mineral, restricted carbohydrate and fat, high fiber diet can prevent overweight. Calorie restriction for weight reduction is safe and most effective. Physical exercise. A low-calorie diet accompanied by moderate exercise will be effective in causing weight loss. Meditation, yoga, and physical activity can also reduce stress related to overeating. Heart disease. Cardiovascular disease (CVD) is associated with diseases of the heart and blood vessels. Think of your arteries as vital highways for your blood, delivering oxygen to every part of your body. But what if these highways become clogged with sticky, dangerous debris? That is what happens in atherosclerosis, where cholesterol slowly builds up in the walls of your arteries. Let's dive into your bloodstream to see how this condition develops and what it means for your heart health. Arteries are flexible tubes that carry oxygen-rich blood to all of your body. Every artery has a wall and inner lining and an open space in the middle. The heart pumps blood through the artery like water flowing through a pipe. Cholesterol, a kind of fat, travels in the blood. See the yellow specks in the blood? Those are little particles of fat. Although cholesterol is necessary for many bodily functions, like building healthy cells, high levels of cholesterol can increase your risk of heart disease. Atherosclerosis begins when something injures the inner lining of the artery, like high blood pressure or smoking. Cholesterol starts to burrow under the artery's inner lining, causing what are called fatty streaks. This can begin at a young age, though it may not cause problems until years later. The cholesterol causes inflammation, and plaque made up of cholesterol, fatty substances, cellular waste products, calcium, and fibrin develops. Now see this. This is a fibrous cap that grows over the top of the plaque. The cap holds the cholesterol inside the plaque. So far, this plaque hasn't affected the flow of blood through the artery, but over time the plaque can continue to grow. It invades the space in the middle of the artery and slows the flow of blood. Atherosclerosis can affect arteries anywhere in the body, leading to serious complications like heart attacks, strokes, and peripheral artery diseases. When atherosclerosis affects the arteries of the heart, it can cause chest pain. When the heart needs more oxygen-rich blood but cannot get enough due to narrowed arteries, it is not usually life-threatening, but it can be a warning sign of a higher risk of heart attack. A heart attack occurs when the flow of blood to the heart is severely reduced or blocked. Plaque can sometimes rupture into the bloodstream, and the blood clot can form at the site of the rupture as the blood clot gets larger. The amount of blood flowing by it decreases when it blocks blood flow entirely. Oxygen-rich blood cannot reach parts of the heart muscle, leading to damage. When a plaque ruptures in an artery feeding the brain, or when this happens elsewhere and the clot travels to the brain, it can cause an ischemic stroke, which can kill some brain cells due to lack of blood. Peripheral artery disease occurs when atherosclerosis narrows the arteries in your legs, reducing blood flow and causing pain, cramping, and even potential tissue damage. More to know. Desirable level for blood cholesterol should be less than 200 mg per deciliter for Indians. The risk of coronary heart disease increases slowly as blood cholesterol level increases from 200 to 300 mg per deciliter. Risk factors: hypercholesterolemia. This means having too much cholesterol in your blood. Cholesterol is a type of fat that your body needs, but too much can be harmful. Hypertension. This means having high blood pressure. Blood pressure is the force of your blood pushing against the walls of your blood vessels. If high cholesterol or high blood pressure aren't treated, they can cause serious problems. Brain and kidney. These are important organs that can be damaged by high cholesterol or high blood pressure. A stroke is a serious condition that happens when blood flow to the brain is cut off. Causes. Heredity. This means that if your parents or other family members have heart disease, you might be more likely to have it too. Diet. Eating too much saturated fat and cholesterol can raise your cholesterol levels. Obesity. Being overweight can increase your risk of heart disease. Age. As you get older, your risk of heart disease increases. Cigarette smoking. Smoking damages your blood vessels and can raise your blood pressure. Emotional stress. Stress can contribute to heart problems. Sedentary lifestyle. Not getting enough exercise can increase your risk of heart disease. Excessive alcohol consumption. Drinking too much alcohol can damage your heart. Physical inactivity. Not being active enough can also increase your risk of heart disease. Symptoms. These are signs that something might be wrong with your heart. Shortness of breath. Feeling like you can't catch your breath. Headache. Having a pain in your head. Tiredness. Feeling very sleepy or weak. Dizziness. Feeling like you might faint. Chest pain. Having a pain or discomfort in your chest. Swelling of leg. Having your leg look swollen. Gastrointestinal disturbances. Having problems with your stomach or intestines. Do you know HDL, high density lipoprotein or good cholesterol, lowers risk of heart disease, while LDL, low density lipoprotein or bad cholesterol, increases risk of heart disease. Prevention and control of heart disease. Diet management. Reduction in the intake of calories, low saturated fat, and cholesterol rich food, low carbohydrates, and common salt are some of the dietary modifications. Diet rich in polyunsaturated fatty acids is essential. Increase in the intake of fiber diet, fruits and vegetables, protein, minerals and vitamin are required. Physical activity. Regular exercise, walking and yoga are essential for body weight maintenance. Addictive substance avoidance. Alcohol consumption and smoking are to be avoided. Cancer. Cancer causes about 4 million deaths annually throughout the world. In India, more than 1 million people suffer from cancer. Cancer is derived from Latin word meaning trap. The study of cancer is called oncology. Oncus meaning tumor. Cancer is an abnormal and uncontrolled division of cells that invade and destroy surrounding tissue, forming a tumor or neoplasm, that is new growth. It is a heterogeneous group of cells that do not respond to the normal cell division. The cancerous cells migrate to distant parts of the body and affect new tissues. This process is called metastasis. The frequent sites of metastasis are lungs, bones, liver, skin, and brain. More to know. World Cancer Day is on 4th February. National Cancer Awareness Day is on 7th November. Types of cancers. Cancers are classified on the basis of the tissues from which they are formed. Carcinomas arise from epithelial and glandular tissues. They include cancers of skin, lung, stomach, and brain. About 85% of the tumors are carcinomas. Sarcomas occur in the connective and muscular tissue. They include the cancer of bones, cartilage, tendons, adipose tissue, and muscles. These form 1% of all tumors. Leukemia are characterized by an increase in the formation of white blood cells in the bone marrow and lymph nodes. Leukemia are called blood cancers. Most common type of cancer, which also affect children below 15 years of age. More to know. Types of tumors. Benign tumors or non-malignant tumors remain confined in the organ affected and do not spread to other parts of the body. Malignant tumors. Mass of proliferating cells which grow very rapidly, invading and damaging the surrounding normal tissues. Carcinogenic agents. Cancer-causing agents are called carcinogens. They are physical, chemical agents, ionizing radiations, and biological agents. Physical irritant. Heavy smoking causes lung cancer and cancers of oral cavity, pharynx, and larynx. Betel and tobacco chewing causes oral cancer. Excessive exposure to sunlight may cause skin cancer. Chemical agents. Nicotine, caffeine, products of combustion of coal and oil, pesticides, asbestos, nickel, certain dyes, and artificial sweeteners induce cancer. Radiations. Ionizing radiations like X-rays, gamma rays, radioactive substances, and non-ionizing radiations like UV rays cause DNA damage leading to cancer. Biological agents. Cancer-causing viruses are called oncogenic viruses. Treatment of cancer. The treatment of cancer involves the following methods. Surgery. Tumors are removed by surgery to prevent further spread of cancer cells. Radiation therapy. Tumor cells are irradiated by lethal doses of radiation while protecting the surrounding normal cells. Chemotherapy. It involves administration of anti-cancerous drugs which prevent cell division and are used to kill cancer cells. Immunotherapy. Biological response modifiers like interferons are used to activate the immune system and help in destroying the tumors. Preventive measures for cancer. Cancer control programs should focus on primary prevention and early detection. To prevent lung cancer, tobacco smoking is to be avoided and protective measures to be taken against exposure to toxic pollutants of industries. Excessive exposure to radiation is to be avoided to prevent skin cancer. AIDS, acquired immunodeficiency syndrome. AIDS is a severe viral disease and caused by human immunodeficiency virus, that is HIV. It is a condition in which immune system fails and suppress the body's disease fighting mechanism. They attack the lymphocytes and the affected individual is prone to infectious diseases. Do you know? Dr. Suniti Solomon pioneered HIV research and treatment in India. She set up the first voluntary testing and counseling center and an AIDS research group in Chennai during 1980s. Her team was the first to document evidence of HIV infection in India in 1985. First Indian AIDS patient in Chennai. Transmission of HIV. AIDS virus has been found in urine, tears, saliva, breast milk, and vaginal secretions. The virus is transmitted by an infected patient who comes in contact with blood of a healthy person. HIV, AIDS is not transmitted by touch or any physical contact. It spreads through contact of body fluids or blood. HIV is transmitted generally by sexual contact with infected person, use of contaminated needles or syringes, especially in case of intravenous drug abuses, by transfusion of contaminated or infected blood or blood products, from infected mother to her child through placenta. Symptoms and treatment of AIDS. Symptoms. Infected individuals become immunodeficient. The person becomes more susceptible to viral, bacterial, protozoal and fungal infections. Swelling of lymph nodes, damage to brain, loss of memory, lack of appetite and weight loss, fever, chronic diarrhea, cough, lethargy, pharyngitis, nausea and headache. Diagnosis. The presence of HIV virus can be confirmed by Western blot analysis or enzyme-linked immunosorbent assay, that is ELISA. Treatment. Antiretroviral drugs and immunostimulative therapy can prolong the life of the infected person. Prevention and control of AIDS. The following steps may help in controlling and prevent the spreading of HIV infection. Screening of blood from blood banks for HIV before transfusion. Ensuring the use of disposable needles and syringes in hospitals and clinics. Advocating safe sex and advantages of using condoms. Creating awareness campaign and educating people on the consequences of AIDS. Persons with HIV or AIDS should not be isolated from the family and society. More to know. Many people are ignorant about AIDS, and it has been said that don't die of ignorance. In our country, National AIDS Control Organization and other NGOs are educating people about AIDS. Every year, December 1st is observed as the World's AIDS Day.